Are you ready to shatter ceilings, to redefine what's possible in your life and business? Then welcome to the Beyond Woman podcast, where we dive deep into the heart of empowerment, the art of crafting a lifestyle business that truly serves you, and the tools to unlock your most authentic, powerful self. I'm your host, Jacqueline Walker Johnson, and here we celebrate the women who are rewriting the rules, the visionaries carving their own paths, and the experts who are sharing their hard-won wisdom to guide us all. Join us for intimate conversations with women who are not just talking the talk, but walking the walk. Women who have the expertise and the sheer grit to empower you to step into your limitless potential. Get ready to be inspired, challenged, and transformed. This is the Beyond Woman podcast. Let's begin. This episode of the Beyond Woman podcast conversation is brought to you by the Beyond Woman magazine, a magazine for the Caribbean woman, created to inspire growth, healing, and success through powerful stories and meaningful features. From entrepreneurs and leaders to everyday women doing extraordinary things, we spotlight voices that deserve to be seen and heard. Visit www.thebeyondwomanmag.com to learn more. Across the Caribbean, women are often the pillars of their families and communities. We show up for everyone, our children, our partners, our parents, workplaces, churches, and communities, and the list goes on, right? But when it comes to our own health, many of us have been conditioned to endure pain quietly or simply push through. And the statistics tell a powerful story. Studies show that Black women are 2 to 3 times more likely to develop uterine fibroids than women of other ethnic groups. Many Caribbean women also face higher rates of conditions like PCOS, hormone imbalance, infertility challenges, and pregnancy complications, all of what we're going to be talking about today. Yet despite these realities, conversations around reproductive health are still often surrounded by silence, stigma, or misinformation. Many women grow up hearing things like painful periods are normal, you just have to deal with it. Don't talk about those things, but our bodies were never designed to suffer in silence. And so today's conversation is about changing that narrative, and joining us is Dr. Rachel Corridon, a Trinidad and Tobago-based obstetrician and gynecologist, founder of Harmony Health, Women's Health, and Home Birth Services. And she's widely known as your Gentle Gynecologist. She is dedicated to redefining women's health in the Caribbean through compassionate patient care that prioritizes dignity, informed choice, and respect. Dr. Corridon provides comprehensive care for women at every stage of life, including fibroid treatment, fertility care, pregnancy preventative screenings, and home birth services. Guided by her philosophy, your body, your baby, your way, she is passionate about helping Caribbean women better understand their bodies and make confident decisions about their health. Dr. Corridon, welcome to our platform. It really is a pleasure to have you here.
Thank you so much, Jacqueline, Beyond Woman. I am so happy to be here, not physically, but one day I am going to touch down in the Bahamas.
But isn't it wonderful that, we can get together virtually in any event, It really is a wonderful thing, this whole matter of technology.
Yeah, the world has become much smaller.
Exactly. So before we dive into the medical side of things, right, it's always meaningful to understand the journey behind the person. Many physicians choose their specialties because of personal experiences, maybe because of someone, maybe a mentor, or it could be moments, right, that shape their calling. So tell us a little bit about yourself, Dr. Corridon. What motivated you to get into this field, and how did you become known as your Gentle Gynecologist? I want to hear all about that.
Well, the way I tell this story is that from the moment I can have memories, all of my memories, a lot of them involved being in the main hospital at the time, the Port of Spain General Hospital here in Trinidad and Tobago. And the reason why I was there is because I was mostly waiting on my mom. She is a nurse, once a nurse, always a nurse. She's retired now. And she was an operating theater nurse. So an RN, a scrub technician. She became a midwife. She went on to become a district health visitor as well. And she did very well in her career, but in my formative years, I spent a lot of time with her at work. And she would be in the operating theater. And in the theater, there was something called a viewing gallery. I should not have been there, but I knew how to find it. And I would sometimes take a peek over the theater down into the operating room from the viewing gallery and see them, I call it a dance, see them in their greens, moving around the operating theater. And it was so fascinating to me as a child. But I didn't want to do obstetrics at that point, but I knew that I wanted to be a physician. In those days, I thought, oh, I love children. I would like to be a pediatrician. But no, from the moment I set foot in my pediatric rotation, I knew it was not for me. And I had my aha moment the first day I set foot in my gynecology rotation. And I saw that beautiful connection between the physician, the patient, the baby. And there was a bit of surgery in it as well because I'm very hands-on. And so I thought that, it marries everything that I love, surgery, children, being hands-on, active, and also caring. And so I chose obstetrics and gynecology. So that's where I am today.
Wonderful. And I love how you talk about the caring aspect of it, and so tell us, how did the name, the Gentle Gynecologist, come?
That name came from my patients. They would always say, Doc, you're done. That's in Trinidadian, language, you're done. I didn't feel that. And one day, one of my colleagues, I was taking care of her during her pregnancy. And after seeing her during that appointment, as we were walking out of the room, she said, Rachel, we are on first name basis. She said, Rachel, you are a very gentle doctor. Wow. And I said, that's something right there. And so it just started to become something that I would say because of what my patients reported to me. And, it stuck. You're a gentle gynecologist.
Wonderful. I love it. And I know I am the one seeing you. The listeners are not seeing you. And I must say the aura that I'm getting from is one of real gentleness, Dr. Corridon. So it really is a fitting name for you, right?
Thank you.
All right. So, in our Caribbean sphere, in our Caribbean homes, as we said in the intro, discussions about reproductive health, they're somewhat limited, right? And as young girls, we grow up hearing that the pain, the heavy bleeding, the irregular cycles are just simply a part of being a woman. But for many women, those symptoms can actually probably be warning signs of deeper issues, right? Why do you think this mindset first and foremost exists? And what are the dangers of us normalizing the pain that we go through as we go through our menstruation period?
I would say no one is really at fault. That's just the way things were. And we are swiftly changing from that. Women were built to endure, to take, right?
Gosh, listen.
So, you take everything and you bear everything and you don't complain. When we were growing up as little girls, we were told girls must be seen and not heard. So, we were trained to be muzzled, to not have a voice, to not say when we are unhappy about something. But we are seeing that as I wouldn't say our generation has passed along and we are having our own children. We are seeing more that we are having open conversations, things about your body, telling our young girls, babies, from the time they can talk, this is your body part. That song, these are my private parts that you're seeing on TikTok and stuff. We are telling our young girls about themselves, what is normal, what is not normal. And we are no longer telling them you have to endure it. And so our grandmothers would not have spoken about these things. I can't tell you that my grandmother ever told me anything about female health. I never had such a conversation with my granny. And we used to speak about everything. She was like one of the main persons in my life. But my mom, on the other hand, she broke that taboo. She would open little books, she would, in those days it was books, not videos or YouTube. And she had a little book for my brother, she had a little book for me, and she went through changes of the body, what to expect, and all of these things. So we were totally prepared in terms of puberty and all of those things, what to expect as life changes. Now, it doesn't mean that we knew everything or we didn't make mistakes, but we had knowledge, and that knowledge helped us to be able to navigate life a little bit easier, a little bit better. And so I wouldn't blame the ones that went on before. They didn't know. This is the way that they were trained. This is the way that they were brought up. But we are now changing that narrative. And so we are no longer saying to our young girls, pain. Now, there is normal pain, but excruciating pain that affects your quality of your daily life, that is not normal. So I say it in a simple way. If you have to miss school because your period pain is so severe, then that is not normal. Mm-hmm. If you are unable to go to work because you have to change a pad every 30 minutes or an hour, then that is not normal. And a lot of women would have been going through these things for years and not saying anything, not attending to it because they were not aware. But conversations like this on the Beyond Woman podcast, or just having conversations online, social media, it's bringing awareness, to the different issues that women are facing. And so we are not being silent anymore, and we are able to take action.
I love it. And I'm happy that you talk about the fact that it's changing. And it leads me to another question about women wanting to seek medical care, being comfortable seeking medical care, because sometimes it's very hard, because there's the stigma that is attached to this whole thing that we're talking about. So I want to ask you, what does a more compassionate and respectful approach to women's healthcare, how does that look in practice?
It starts with listening. And even before listening, it starts with the patient experience from the time she books her appointment to the time she enters the room. It should be a comfortable space, a space that reflects womanhood, not too sterile and harsh. So I try to create a comfortable environment for my patients, even if they ask me a question over WhatsApp. We try to make it light. We try to make it inviting, encouraging them to ask questions, to take an active part in their health. I try in terms of when they are in the room to eliminate fear, to eliminate taboos. I tell them nothing is off limits. We talk about everything. We talk about intimacy. We speak about, let's say, life changes, perimenopause, menopause, how it's affecting you. We speak about mental health. We speak about everything. We touch on everything. And where there's a need, I would obviously refer on. But sometimes a woman just needs to have a listening ear. And for me, it means that if I see one less patient in that day so that I can have a slightly longer consultation time, I am happy with that. And I think that's really important, that women don't feel rushed. We are rushing every day in everything that we do. You get up at 5 a.m., 4:30, you're rushing in the kitchen, you get the kids ready for school. You rush to get them to school. Then you get to work. You may or may not have a meal. And then you leave work early, you go get them, you get home, you do the homework. So we are always rushing. There is no time where we can sit back and reflect and take a time out for ourselves, So in my room, I give a moment for women to just, Musa, let's talk about it. What's going on? So listening, environment, comfort, eliminating fear, identifying trauma. That's also very, very important. There are some women who, from the moment they enter the room, the level of anxiety that they have upon entering the room, I know that something's up, you know? And so I will approach the conversation. Is there anything that is making you uncomfortable in having a gynecological exam or seeing a doctor in this kind of private and intimate way? And a lot of times they would reveal that there may have been a traumatic event, you know, in their childhood or something. We wouldn't go deep into it, but I do let them know that this is a safe space, you
Right.
know? And
Right.
just simple things like that, even before we get into the medicine and into the science, it's just letting the woman know you are safe.
When you mentioned before we get into the medicine, I just had like a moment there because I remember quite recently I had to go to a male doctor, someone who I'm not familiar with. And he's an older gentleman. And
Yeah.
it had to do with a lump in
Okay.
my breast, a painful lump. As most women do, we have the fibrocystic breast,
Right.
right? But this one in particular was a little bit concerning because it was painful. Okay.
Yeah.
Anyway, the long and short of what I'm trying to say is that this gentleman and I had a conversation about everything except what I came to do. And this conversation lasted an hour or more. And I'm like, doctor, you don't have any more patients. I said, you don't have any more patients to see. And then, he went on to explain that sometimes, especially because I'm a new patient, it's important for him to establish that kind of trust, establish that kind of caring environment. And I really, really appreciated that. And I really am hoping that it is a general thing that is out there, because I know that there are some instances where it can be a little bit also traumatic, the visit.
The visit itself, correct. Yeah.
Yes. And so I feel like it is so important for us to really talk about this, for doctors to understand that it's not just about the diagnosis and the treatment, but it's also about the person.
Correct.
You have a
And
person in front of you.
yeah,
Yeah. So I really appreciate that is the space that you operate from. And I'm really hoping that it's more the rule than it's not, right? All right. So I want to talk a little bit about fibroids because that's a big thing out there right now. And it is one of the most common conditions that's affecting Black women generally. But I get to understand that Caribbean women to a great extent as well. So a lot of us as women, we don't really know that we have fibroids because the symptoms are not so severe, or it's not until the symptoms become severe that we go and we get diagnosed for fibroids. So let's talk a little bit about why it's so prevalent in the Caribbean region. Is it a lifestyle, or is it lifestyle factors that's causing us for it to be prevalent? And what are some of the treatment options that are available?
A major part of fibroid and the prevalence in our community is down to genetics. A lot of us have Afro descent, and we know that from statistics, women of Afro descent are more likely to have fibroids, and also fibroids that are more severe in terms of size and the symptomology, right? But it's not just genetics. We know also that fibroids respond to hormones. So estrogen, especially, it would cause the fibroids to grow, estrogen and progesterone in a little more minor way. And so our obesity profile as well tends to lead to more conversion into estrogen, feeding now these fibroids in our body. We also have to look at our diet, and we know that a diet high in red meat can lead to, so all the lovely meats that we love, just like myself, you know. And also we look at a part of genetics in terms of family history. Therefore, if your mom or your sisters, your grandmother had major fibroids and caused them symptoms where they had to have a hysterectomy or so, you are more likely to have severe symptoms or have fibroids. And you are quite correct that until you start to have symptoms, you wouldn't really know that you have fibroids. Fibroids can be very tiny, minuscule. We call it sub-centimeter, so less than a centimeter. And then you have fibroids that can look like a whole pregnancy, where the woman appears pregnant all the time. So the womb could be as big as right under the rib cage and all out there like a pregnancy. So fibroids have ranges in size, and they also have ranges in how they affect us. A woman could have multiple fibroids and she has no symptoms, whereas a woman can have one fibroid and she's living a life of health, right? It all depends on where the fibroid is located and therefore how it affects you. Now, some of the ways that fibroids can affect you, it can be abnormal bleeding, it can have issues with respect to your fertility, and then you have the pressure symptoms, especially as the fibroids start to become a lot more enlarged, pressing on your bladder. And of course, the cosmetic issue. We can't leave that out. Because if you're a woman who, let's say, has no children, and someone is constantly asking you, "You pregnant? You pregnant?" You know, this can be a major point of contention. Or if you went on a major weight loss drive or goal and you achieved your weight loss, but this tummy is still out there because of the fibroid, it can cause, a bit of distress. And so these are some of the ways that fibroids affect us, and these are some of the reasons that we get fibroids in the first place.
So, what about like treatment options or preventative care? What can women do?
In terms of prevention, we may want to adjust our meat profile, how many times we consume red meat. We would want to watch our weight, stay a little bit more on the lean side. But as I said, it's a matter of genetics and sometimes just random mutations of a single muscular cell. And so you can't always prevent the issue from happening.
Right.
When it does happen, there's a range of options in terms of your management. The first one being doing nothing. As I would tell my patients, sometimes they would go to a doctor for one reason. Let's say they had abdominal pain. So they did a scan. There were no symptoms previously, nothing related to female health. And they find a 2-centimeter fibroid and they go into a tizzy. No? Oh my God, I have fibroid. But they have no symptoms. I would tell them, listen, if it's not troubling you, don't trouble it, right? So that's one way. We do nothing. Another way is to manage symptoms. We can manage symptoms using medication, using lifestyle modifications. We can use medications to reduce your bleeding. We can do pain management. Yeah. And then we have minimally invasive options. And this would be to reduce the blood flow to fibroids through your uterine artery, which is the main artery that leads to the womb. Yeah, so if we can reduce some of that blood flow, the fibroids decrease in size, and also it slows the growth of the fibroids. So women who are not really, looking for surgery, because remember this surgery is major. So women who don't really want to have surgery, or women who want to not have the risk of losing their womb by having fibroid removal surgery, they may opt to doing this uterine artery. We call it UAE or UFE, uterine fibroid and artery embolization, or uterine artery embolization, right? And then we have the surgical option. These can be open or closed, meaning we can do one cut in the lower abdomen or up and down on the middle, or we can use cameras, so small port, and we do it laparoscopically, right? So you have open or closed myomectomy or fibroid removal surgery, and open or closed hysterectomy or womb removal surgery. If fibroids are quite small, we can sometimes even get the womb out through the vagina, and that is called a vaginal hysterectomy, which you can actually get up and leave the hospital the same evening. Yeah? So these are some of the options in terms of managing your fibroids.
You know, I'm listening to you and I wonder if men go through all of what we go through. I feel like we have so much more to deal with than the men. You're a doctor, tell me. They
men
have
go
their fair
through?
share?
So they have their fair share. Men can get testicular cancer. They can get swellings in their scrotum. They can
How prevalent is it?
It's
You don't hear. Oh, well, maybe we need to start having conversations about those things because you don't hear them talking about anything really related to men.
But sense is something men go through, but they don't talk about it. But they go through it, so they have their fair share. As I usually sometimes, I'm always open to the man being there if the wife or partner wants him to be there. And so when we're having conversations, she will say the same thing you say to the man. She'll turn to him and say, "Oh, let us have to go through all of this." And I will say, "Trust me, you don't have to get a DRE." Which is a digital rectal exam, right? And the room will get light. You'll have a laugh. So yeah, the men do go through their share of medical conditions. Yeah.
Yeah, but you just, well, I said that, we should probably have conversations surrounding the things that men go through because I realized that it's not very different between the female and the male in terms of the stigma and how we feel and, the trauma around just going to get the medical advice. I don't think there's really any I think it's more so difficult for men, because nobody wants to go and get that examination for the prostate thing, so
they avoid it like a plague.
Yes, and then what does that do though? Because that's preventative care. That's preventative care. But anyway, I want to talk a little bit about self-care and the fact that we tout self-care, and it really is all about the massages and the spa treatments and those kind of things. But let's talk about the self-care that is related to our health and going in for our gynecological care. Isn't that a form of self-care that we should be pushing?
Most definitely. So yes, we go religiously every 2 to 3 weeks. We do the nails. We get the pedicure done every 2 to 3 months and all of that. You see my hair? Well done. I make sure that is done. However, you only need to see the gynecologist once a year. If everything is going well, that only needs to happen once a year. And so I always encourage my patients, come in for that one visit. It doesn't always have to include, deep examination, especially if you're up to date with your pap smears. Believe it or not, once we do it with something called liquid-based cytology, you can do it every 3 years, and if we add HPV testing, you can stretch that out to every 5 years of doing the actual pap test. And in some jurisdictions, like in the UK, they are moving away from the pap test as the first test, and they're going straight to HPV testing. So you have
one second, Doc. You said HPV.
HPV or human papillomavirus.
Oh, okay. Yes. Mm-hmm.
Human papillomavirus is one of the most common sexually transmitted infections. Most of us don't know that we ever were infected or encountered it because your body would clear the infection. You have high risk types and you have low risk types. The high risk types lead to anogenital and oropharyngeal cancers. So tongue, head and neck, cervix, anal, penile cancers. But the low risk type lead to what we call genital warts. So those cauliflower-like growths that people will see on their genitalia from time to time, so in the private part, right? So that is HPV. And what we have found is that HPV, or human papilloma virus, causes over 90% of cervical cancers. So guess what? We have HPV vaccination, which we introduce to our adolescents, teenagers, and our young adults. And we try to catch them in that age group before they become sexually active, so that they are protected against HPV when they do encounter it. Because once you become active, you are likely to encounter it. It's everywhere, right? But because it's not something that you will always see a lesion for, or you will get sick from, you don't know that you encountered it. So doing the vaccination is very important. And on the flip side, in terms of screening, so that's prevention. In terms of screening, if we are able to detect HPV or not detect HPV, we are able to classify women in terms of risk and then direct them onward in terms of management. So HPV is a very, very important tool in terms of cervical cancer screening, detection, and management.
Mm-hmm. So you made some very important points that I, a big girl of this big age, didn't know. I just thought that the annual, or maybe it's just information that doctors would rather not say for whatever reason. The fact that we don't have to, there are things that can be done to prevent us from going to them every single year. Because you mentioned that even the HPV can cause you to go every 4 years, or was that every 2 years? So,
to clarify, I still advocate for seeing your doctor every year.
Okay.
But we don't have to do the PAP test every single year. And we can stretch it out to 5 years when we add HPV testing. That's just to clarify. Because when you see a doctor, just by, as I always tell my students, you don't have to touch a patient before you can have an idea of there being something wrong or amiss, a basic history. So when you check in with your doctor, you are able to have a conversation, and through that, we may be able to zone in. I may be able to say, maybe we should do an ultrasound this year, or let's do an examination, or we may start to have conversation. Have you considered maybe you are in perimenopause based on the symptoms, the things that you're talking about, the things that you are experiencing? So we will not eliminate that yearly checkup, but we may be able to eliminate some of the testing.
Got you. Okay, awesome. All right. So across the world, conversations about childbirth are evolving. More women are asking questions about autonomy, birth plans, and personalized care. And Dr. Corridon, you often say, your body, I had to get to this, right? Your body, your way, your body, your baby, your way. What does informed choice and autonomy look like for Caribbean women navigating pregnancy and birth? And talk to us a little bit about that tagline.
All right. So traditionally, medicine has been very paternalist. This is my plan for you, and this is how we're going to go forward. Rarely patients had a voice, and in that voice, an opportunity to gain understanding. And so in terms of the International Women's Day theme this year, it was give to gain. And so just that theme in this conversation, give information to gain compliance, right?
Mm-hmm.
So for me, how I deal with my patients, yes, I may want to, let's say, do a cesarean section. But I would take the time, especially if we have the time, and explain to you why. And we bridge that conversation even from our first visit. Always talking to the patient and explaining to them that things can change during a labor and delivery. Nobody wants to change your plan or your desires, but these are some of the things that can happen along the way that could cause changes. And most of the times when patients are informed, when they understand, when they don't feel like someone is strong arming them, they are more likely to agree. So it's more about information. It's about giving patients the tools to actually safely do your body, your baby, your way. Most of the times when they have that information, they will say, yes, doc, let's go. It's very rare that you would find a patient putting their life and their baby at risk in terms of going forward with a management plan. So the basis of it is hearing the patient, firstly, what are her thoughts on the matter? How does she feel? Does she actually understand what we are saying or what we are offering? And also involving partners. You know, as we would say long time, it would just be the woman, the nurse, maybe a doctor, an intern in the room. We are having family members, especially in the hospitalist kind of system, where women are not really delivering at home anymore. In the comfort of their home, their family, they're delivering in hospitals and nursing homes, etc. We ensure now that our partners are present. So even if mommy is in a lot of pain, so she's not able to comprehend or take this all in, the partner is there. So
Yeah.
the partner is educated, and he or she at the time is able to say, all right, dear, it's okay. This is what's going on. It's all right. You'll be all right. The baby's going to be all right. So in information, comfort, hearing, empathy, all tie into that mantra. Your body, your baby, your way.
I love it because it's a really involved process, it seems.
Right. Yeah.
And I don't know. I think if you had a choice, that would be the way to go, right?
Yes, it would.
It would be the way
And
to go.
it would be the way to go. And I would say in terms of the way that I saw my mom practice her craft, midwifery. She would spend so much time with her patients at their home. The family would be involved. The children would be involved. They would get to palpate or feel the tummy. She would explain to them, this is where the baby's head is. This is where the buttock is. Did you feel that kick? You know, so you feel part of the process of what is happening in you and with you. And so it's not happening to you. And I think that's very important because as we go back to the top of our conversation, a lot of times things happen to women and we don't have a say. So involving them in their care and having them have a say, that's very, very important.
Mm-hmm. And the family element is important. And I can see that just changing how we interact as Caribbean people because, you know, I've had lots of conversations where we talk about the woman deserving care, you know, and the woman deserving to be in a space where she feels supported. And oftentimes that really isn't the case, not because it's not available, but because psychologically we have been wired to think that we're in this alone, you know, and I really love that kind of a direction. Because listen, this journey of pregnancy into motherhood, it's no easy. I don't know. When you started the conversation, you said endure. I don't love that word. Honestly, I don't love that word for us. And so I am happy to know that, you know, at least at some point we're moving towards a space of more care.
Definitely.
You know, more involvement and giving the woman a voice as well and the information that she needs to make decisions that will support her and cause her to feel safe, right? And cause her to feel safe. I want to ask you, Dr. Corridon, what are some of the early signs women should never ignore when it comes to their reproductive health? And, you know, we're talking a little about some of the things that we talked about already, the PCOS, the fertility, that kind of thing.
So I would take a head to toe approach. So there's something called PMS, for instance, so premenstrual syndrome or premenstrual dysphoric disorder, PMDD, which is a severe form. So let's start with the head. So your emotional symptoms surrounding your period. Don't ignore them. You're not crazy, one, and nobody should tell you that you are, especially if you know that this happens around the time just before my period, I kind of turn into a different person. Seek help. Come in. Let's talk about it. There may be options for you in terms of us managing that. Things like depression, anxiety, these things may come on and set in when a woman is approaching menopause. Let's not ignore it. So that's the head. Then let's talk about the breast. Every woman should know how to do a self-breast examination. And it starts simply with looking. My thing is, look, feel, squeeze. So you want to look at the skin of the breast, look at your nipples, look for changes. And as we are on that topic of changes, know what is your normal, what you usually look like. Yeah. Go in front of the mirror and look at yourself. It shouldn't be, a lot of times, we have found that it's the partner, the male partner that finds the issue and not the woman, because she's not in tune with herself, but she's in tune with everyone else, right? Mm-hmm. So knowing your body, knowing yourself, knowing what is your normal and being able to detect when things change. In terms of your pelvic area, you want to know when you are having abnormal bleeding, which could be a range of things. Heavy menstrual bleeding or heavy period, spotting in between your periods, spotting or bleeding after having intercourse or intimacy, bleeding when you have entered menopause. So after that 12 months of no bleeding, I have my patients say, I should never bleed again. And I drum that into them because a lot of the grannies hide this bleeding and they come in only when maybe a granddaughter or somebody noticed that Granny is bleeding. Granny, what's going on? This has been happening for years and she didn't take care of it. Wow. This is a sign of potential cancer of the womb. So after the 12 months, when you are in that specific age group of menopause, you should not have any bleeding from that vagina. Even if you see a spot coming, pain, abnormal pelvic pain. Women live with pain. They eat it, right? So we want to address pain during our periods. We want to address signs of endometriosis, which includes chronic pain, pain before, during, and after your period, pain with passing stool, pain with having intercourse. All of these things point towards something called endometriosis. We want to also look at outward other signs like facial hair, missing or skipping periods, darkening behind the neck, rough and dark skin behind the neck, under the arm. These are all signs of something called insulin resistance. And in combination with abnormal bleeding, this leads to detection or, possibility of polycystic ovary syndrome. So knowing your body and knowing when there are things that may be a little bit off, that helps you to know when to come in to the doctor and get checked. It's all about knowing your normal. Yeah.
Mm-hmm. And you made a very important point earlier on when you said women are in tune with everyone but themselves. And sometimes it's the partner that sees something amiss. And I don't know, this conversation surrounding women, it is such a huge thing. We are so bombarded with the different roles that we have to play. Some of us are caregivers, we are mothers, we are leaders in our community. And as you said, we're caring for everybody else, but we're not caring for ourselves. We're in tune with what's happening with others and we're not in tune with ourselves. And I want to ask you your thoughts on this. How can we as women prioritize our health without feeling the guilt? Because oftentimes it's the guilt, aspect of it that drives us to be everything to everybody else and nothing to ourselves?
The way I put it is this: making your health a non-negotiable. The same way the children must go to school, you must take care of your health. So it's a non-negotiable in your life plan. Once a year, you are going to do your checkup. If there's something going on, the next available opportunity you have to get checked, you are making that appointment. The time has to be carved out of the family schedule for mommy to go see the doctor. you know, ensuring that you don't hide things and that you make those around you, those who need to be informed. So let's say your partner, listen, this is what is going on. I think I need you to accompany me to the doctor. And believe it or not, they do come. A lot of men accompany their partners to the doctor. So they will come.
Yeah.
And we touch on fertility even, and women tend to come alone when we're talking about fertility. I encourage them to come with the partner because it takes two to tango. And so you shouldn't be suffering alone, and you shouldn't be suffering in silence when it comes to that topic either. Come in. Let's talk about it. Let's see how we can find a solution, how we could try to help. So just make your health and your life a priority in the mix of everything else. Make it a non-negotiable. And I think that's the way forward in making women's health better, more manageable, and reducing the trajectory of things progressing to a point where we cannot help.
And I want you to talk a little bit, because I'm listening to you and I want to admit something, that it, even for me, it's not easy to see something abnormal happening and then having to go to the doctor. There's just this fear. I don't want to know. I'm all right. I'm moved beyond this thing. Let's talk about the fear that, we have surrounding a diagnosis and help that woman to get over this fear.
The way I deal with that with my patients, even when we are breaking bad news, I tell my patients, listen, knowledge is power, right? Knowing gives you the tools to move forward, to act. If you don't have the information, you are unable to make steps to change or to manage the situation. And so I also tell them, we're not talking about this going to be bad. We are saying this is the test that we are going to do, and this can be a potential outcome. And so this is how we are going to deal with the outcome X, the outcome Y, the outcome A, the outcome B. So even in doing the test or doing the examination, I kind of give them a little preamble about avenues that things can go. And so that tends to dampen and eliminate, dissipate the fear a bit, because they already know that, listen, I did this test and this is something that can come up. And when it comes up, this is how we're going to deal with it. So I would say to women, fear cripples you. It causes you to have things go beyond a point of no return. There's a big difference between stage 1 cancer and stage 4 cancer. There's a big difference in management opportunities. There's a big difference in your ability to survive. So your survival rate. We can remove a stage 1 cancer and you go on to live many, many years of normal life. Right? So knowledge is power and fear is crippling.
We just need to the point is that if you want to live, because ultimately that is what you want, right? So when you don't go and get whatever help that you need, right? You sit with whatever the issue is, then you're reducing your chances of living, right? So it just makes sense. it just makes sense. I want you to share something with me because, sometimes the most powerful lessons come from experience, right? So you don't have to share any personal details, but can you tell us about a patient experience that deeply impacted you and reminded you of why you're doing what you're doing and why your work matters?
What really impacts me the most would be seeing about my pregnant patient. And well, I would give this example. I was seeing a patient, and she was what we would call advanced maternal age. And during the antenatal care, coming down to the end, we realized that there was a problem with the growth of her baby and the blood flow between her and her baby across the afterbase or the placenta. And I didn't realize how much my conversation with her at the time impacted her, and how much us putting her forward to further care and getting delivered and all of that, how that impacted her. And this was about 3 years ago. Let's fast forward to about a week ago. I meet this person in the mall. I don't recognize the person. And she walks up to me and she says, "Dr. Corridon, look your baby." And I'm like, "Hi."
Listen, I easily get emotional, Oh my goodness, yes.
And she says, "Dr. Corridon, I say a prayer for you every single day because you saved my life and you saved my baby's life." And I said, "Really? Tell me about it." And then she reminded me about the issue and all of that. And so we go about our day-to-day life as physicians. We do the right thing. We see about our patients. We care for them. But what we don't realize is that for us, they are one of our patients. But for them, we were their one physician. And that impact is something that I carry with me. Every patient that I see, a piece of me goes with them, so to speak. And it goes on, especially if I help them with their delivery. If their baby survived and everything went well and we navigated challenges, or they got pregnant after trying for so long and I was able to walk them through fertility and all of that. These are the things that impact me and help me to see that what I do matters, what I do has a lasting impact, and what I do has many little feet walking around that I don't even know about.
Oh, that's such a beautiful story. I love that. I love that. Let me ask you this. As someone who spends every single day helping women take care of their health, what are some of your personal habits that you practice in your own life to stay well?
Well, we say us physicians, we are our worst enemy and we are the worst patient. So I will not say that I am perfect at it, but I do try my best to do things like water intake, having a good water intake. I am trying, as the year entered, I noticed my weight had become way more than I was willing to accept. And so I have made steps to contact like a dietitian. I've made steps to contact a weight loss physician to see how I myself can navigate this weight issue and be a better example for my patients. So that's me. For this year, I've already seen my doctor. I've already had my pap smear. I've already had my breast ultrasound. And so I've done my blood work, so I know that all of my internal organs are working just fine. I did my diabetes screen for the year, and I don't neglect my mental health, my rest. My husband would say 10 o'clock that, she ready to go in her bed. I don't like to be awake after 10, these kind of things. So simple things like rest, stress management, and also speaking to someone when things become a little bit overwhelming. I don't neglect, and I have no shame in doing that either. So these are some of the things that I do in my own way to try and manage my own health.
Seems very wholesome and very proactive, and I love it. And those are some of the things that I've made note to deal with some of those that are missing off my list, right? But we're at the moment that I believe a lot of our listeners really tune into, and it's the practical steps, right? The practical steps that they can start implementing right away. So I want you to share with a woman who is listening today, well, once we publish this episode, what are a few simple things that she can begin this month to better care for her health? And what are some of the practical steps that you would recommend to this woman?
If you are a woman of a menstruation age, I would like you to start logging your period. That's the first thing. Log when your period begins, when it ends. Start looking at symptoms that you have along the way, like spotting or changes in your vaginal discharge or mucus. Start looking at those things and start logging it. I would say at the end of your next period, do a self-breast examination. See what's going on with your breast. If you haven't yet gotten your checkup, even if it's with a GP, or a general practitioner, that is, and not your gynecologist, at least have a check-in with your doctor for this year. Check your blood pressure, your diabetes screening, check your weight. A lot of times it's only when we go into the doctor we realize how far things have gone. Yeah. I would like to encourage women if they haven't gotten their pap smears yet, to have that done. So we're doing our checkup. We're doing our examinations at home. We're doing our logging. And also for our women who are more in the menopause age, I want you to have that mammogram done, have your colonoscopy done if you are at that age, or your stool test. And let's start moving a little bit. Pop on that YouTube video. That's what I have been doing for the past few mornings. I pop on a YouTube video, even if it's 15 minutes, and do some walk at home or some strength exercises. Just do something. It makes the day lighter. It makes you feel better because it releases a lot of good hormones, good feeling hormones.
Right.
And stuff. And also it reduces your stress. So it increases your energy. So get moving, and let's look at our diet. You may not need to see a dietitian like I did, but at least start looking at your intake of carbohydrates, the types of fats that you take in, the types of meat, the types of protein, increasing your vegetables, increasing your water intake. So these are just general things, practical steps. And also talking about and addressing things when they do occur.
Yeah, and these are powerful tips, but guess what? They're all so easy.
Yes.
Hard. These are things that we should be doing in any event. I mentioned before the fact that we want a long, healthy life. Yeah. And so we have to be proactive in ensuring that we do have a long and healthy life. So powerful tips, like I said, easy tips, and it's a beautiful and great way for us to end our conversation. Dr. Corridon, very informative, on women's health and the general things that we need to know and the tips that we need to take away in order for us to live a balanced, healthy life as women. And let us lead from a place of bravery and not fear, right? And just take control of what we can. A lot of things are out of control. You see what's happening in the world today. But what we can control, I believe that we really need to get involved and ensure that we are taking control. So yeah, this has been an eye-opening conversation because women's health is something that we place on the back burner until something goes wrong. But when we understand our bodies, when we ask the questions, when we get the information, as Dr. Corridon said, and seek the care early, it can make a huge difference, not just for our well-being, but for generations of women behind us, right? It's not just about us, because we have to lead by example. So Dr. Corridon, thank you so much for the work that you're doing and for bringing compassion and care and dignity into the women's healthcare across the Caribbean. And I really hope that other doctors are doing the same thing, because as women, we deserve to be cared for, and we deserve to be in an environment that we feel safe and, one that can allow us to flourish in a healthy way. So thank you so much.
Thank you, Jacqueline, and thank you, Bahamas and the Beyond Woman podcast. Thank you.
And that brings us to the end of this episode of the Beyond Woman podcast. I hope you're leaving feeling inspired and ready to take action. Remember, you are capable of so much more than you think. Keep pushing those boundaries, keep learning, and keep believing in your limitless potential. We want to stay connected with you, so be sure to follow us on social media at The Beyond Woman Magazine for daily inspiration and behind-the-scenes content, and to join our growing community of empowered women. Visit us at www.thebeyondwomanmag.com and www.thebeyondwoman.com, where you will find more resources and articles to support you in your journey. Sign up for our newsletters and be the first to know about our exclusive events and for more opportunities to connect. To all my Caribbean sisters, let's lift each other up. Share this episode with the women in your life who need to hear this message, and let's continue to build this powerful network together. If you enjoyed this episode, please consider leaving us a review on this app. Your support helps us to reach more women. Thank you for being part of the Beyond Woman movement. Keep shining, keep growing, and keep living your extraordinary life.